Instead of prescribing an individual drug, you may choose to prescribe a protocol, and there are various different protocols available. So the first top I'm going to show you is an either-or protocol. So we'll start with paracetamol. So I start typing in para, click search, and you'll see there's 3 options here, and each of them are described with either-or protocol. So with this first one, this is paracetamol caplets and suspension, and so were you to prescribe this, you'd be prescribing both formulations onto the chart, and then it's up to the nursing staff to administer one or the other. So the system prevents the nurses from giving both, and it just affords that bit of choice for the nurses, particularly if the patient has difficulty swallowing. Similarly, there's one that also it contains an IV preparation of paracetamol, and again, it's just so that there's some choice for the nursing staff and for the patients, so that they administer the most appropriate route without having to go back to the prescriber to keep getting the prescription changed. So let's say I'm going to go with the oral paracetamol protocol. So I would select that, and you'll see that the dosing information is already inputted into here, and it will be identical for this particular protocol. So when you go to the confirmation screen, it's showing you that you're prescribing caplets and suspension 1 gram 4 times a day. And as I said, when it comes to the nursing staff, they can then choose which one they want to administer. I can press confirm, and that will add both of those onto my chart as regular. And you see when you hover over it, at the moment there's none that have been administered. But if you were going to review this patient in, say, a week's time, you'd then be able to hover over these and see which is the preparation that the nursing staff have been administering the most to the patient. Another type of protocol is acting as a prompt for you to make sure that you're prescribing in line with our guidelines. So we're going to go with the Antimicrobial Guidelines. If you type INFE for infection, and then I want to look at a particular respiratory infection, so I'm typing RES. You'll see that all the respiratory related infection protocols are then listed. Now, particularly with antibiotics, we would ask, whenever possible, please prescribe via these protocols, because that way you're also documenting the indication and you're making sure that what you're prescribing is in line with our guideline choices. So let's say this patient has aspiration pneumonia, and you'll see as you go along this is the standard one. There's also a penicillin allergy option as well, but this patient doesn't have any allergies, so I'm going to go for the aspiration pneumonia. So I'm going to click that. And as I go through, if you go to order entry, I can see there's amoxicillin and metronidazole. So if you needed to amend the dose, you can do at this point. And then you'd go to confirmation. It just summarises what you're prescribing, and then you'd press confirm. Some protocols act like a shopping basket on an online website where you have various different medication added in. So this particular protocol is Orthopedic pain protocol, and in here there are a number of different medicines listed as part of the protocol. But you might, when you're reviewing this, think, well, actually this patient doesn't need celecoxib, so you might want to remove some of these things from this protocol. And to do that, you would click on the medication, click delete order, and that would just delete that particular medication from the list. Also to note, there's 3 here that have an exclamation mark, so that means that this information isn't complete. And so for this purposes, oxycodone requires you to actually state the dose of oxycodone, particularly as it's a controlled drug. And you'll see on here there are actually 3 doses of oxycodone. That's because in this particular protocol, it's 3 stat doses intended to be given 12 hours apart, and it will be up to the prescriber to actually state when they're going to be administered. So rather than getting trigger happy and clicking OK without thinking about when they're going to be administered, it's asking you to think about that. And then once those details are included, or you might decide actually we don't want the oxycodone, you'd click discontinue, And you see it's very clear that these are discontinued. If you change your mind and go, actually, I wanted this back again, you click on it and then you'd go to restore order. The third type of protocol that you can prescribe on JAC is a variable dose order protocol. So classic examples is when you want a reducing regimen, so prednisolone or perhaps chlordiazepoxide. So I've searched prednisolone, there is my variable dose order protocol. When I click on it, it will list all the individual lines on the left hand side here. So I can see the first line is 40 milligrams in the morning for 7 days. And then underneath 35 milligrams in the morning for 7 days, and so on and so forth until the regimen is completed. Now, I might not want to start my regimen at 40 milligrams. I might want to start it at, say, 30 milligrams, in which case I would click on the line that I don't want and click delete order, confirm, and that's my 35. I don't want that either. Delete order, confirm. Now, with my others, I may very well, rather than want to reduce it very slowly over a 7-day period for each dose, I might actually only want 3 days. So I can click 3, and you'll see it's now changed 3 milligrams, 3. When I'm happy with the regimen, I can then press next. It takes me to the confirmation screen, and I'll be able to see that I've got 30 milligrams in the morning for 3 days, starting tomorrow for 3 days, and then it drops down to 25 milligrams for 3 days. That finishes on the 2nd of September. Then on the 3rd of September for 3 days, the 20 milligrams, and you can see very clearly when the doses are going to be and when the full course is finished, which in this case is the 14th of September. And then I'd press confirm to prescribe it.